fact, with the support from KNH, implemented a project in Chimanimani, a COVID-19 response to Cyclone IDAI affected communities. This project ran between August 2020 and January 2021. The aim of the project was to alleviate the challenges that the Cyclone IDAI survivors experienced during that time. The project targeted 500 children within the camp for PSS activities. It also targeted 300 households for food and non-food distribution. For non-food distribution, it had sanitary wear that targeted the girls between the age of 9 to 18 years. And for food distribution, we distributed food items like mealie meal, matemba, cooking oil, and salt. That was distributed every month to each household. FACT worked with different ministries, relevant ministries during this 6 months. The main ministries that we worked with were Ministry of Social Development. That's the ministry that had the database of all the survivors within the 4 camps in Chimanimani. 3 camps in Chimanimani and 1 camp in Kopa. And all the database and all the names from the database we received from the Ministry of Social Development. With the Office of District Development Coordinator, this is the leading office that gave us the permission to work within the camps. We also worked closely with the Ministry of Home Affairs, the victim-friendly unit, which was guiding us to show us how we would work closely with transparency and accuracy during our distribution. We got very good assistance and from different departments, especially from the police, during our distribution every month, so that we ensure that our survivors maintain the WHO guidelines for COVID-19. Social distancing, masking, washing of hands was done during each and every distribution. We managed to reach our target. 300 households were fed for the past 6 months, and 500 plus children were given psychosocial support activities. As much as we did the food distribution, but we discovered that there are more challenges that needed within the survivors. The children within the camps, some of them are no longer going to school because their parents lost jobs and houses and they cannot survive without education. Most of the children in the camps are there and most of them are not attending school. They also need recreational activity places where they can play during the day, and also the parents need parenting sessions for them to assist the parents so that they'll be able to curb issues that could be happening within the camps.
As a Chimanimani district, we would wanted to express our gratitude to FACT Zimbabwe for the program that they implemented in our district. The program which targeted mostly households which were affected by Cyclone IDAI. They benefited through provision of food, which is a basic human right. We have got camps which were established in the Chimanimani district following the Cyclone IDAI disaster. We've got four camps: Aboratum, Nyamatanda, Garikai and Kopa. And FACT came in handy to assist the households which are still living in these 4 camps. So as a district, we are very grateful that FACT, in collaboration with the government of Zimbabwe, managed to assist the affected households.
Takauyawo pano hatina kutomboziva kuti tichagarawo mudzimba dzakadai dzematengo idzodzi, asi nekuda kwaMwari zvakangoitikawo. Hatitombozivi kuti chii chakaitika kuburikidza necyclone. Tikaunzwa muno ndomatiri nanhasi, taane 2 years tiri mumatengo. Akatidetsera zvakawanda FACT kubva zvayangogumisidza kutipa munhu hatina kana chimwe chikafu chatichambouya.
Vanhu vose pano vakatibatsira kuti tikangane nezvecyclone. Vanhu vakambotibatsira futi nechikafu nekutauraidza zvakawanda.
Mazuva atakawana panapa ndePSS yevana vadiki nechikafu chokudya kuti vakatibatsira zvakanaka zvinotenda chaizvo. But iko zvinezvi uyu chapera manje hatisisina, saka yatokumbira kuti haita vabatsiro kuti tienderere mberi tichidya.
Chimanimani actually was affected by Cyclone IDAI in 2019 on the 15th of March. As you are aware, a lot of people lost their lives. But however, as a department, we've been involved in assisting those victims of Cyclone IDAI. As you are aware, in Chimanimani there are 3 camps. We've got Aboratum, we've got Nyamatanda, we also have got Garikai, and we do have the Kopa camp as well. So those are the 4 camps that are found within Chimanimani. As you know, that Department of Social Development is where the social protection policies or social protection programs are mostly housed. So we did have a partner who came to implement or to assist or to complement government effort on what we were doing as a government institution to assist the victims of Cyclone IDAI. So FACT came in through the component of social protection, but their main thrust was focusing on food assistance to the vulnerable or the victims of Cyclone IDAI for 6 months, in which each family was receiving meal, carpenter, and also cooking oil, and also to some extent some of the children below the age of 18 or some of the women were receiving the dignity kits as a complement to actually have a flourished component or a hamper for each individual or each household. Then we also look at they also managed to assist through the Department of Social Development in training or in capacitating under the PSS pillar. We were saying we wanted to actually support the children who are between the ages of 5 to 18 through the peer-to-peer. We were cascading information on child protection and also to understand the children in terms of their development and also in terms of the referral pathway. Remember, when you talk of PSS, you are looking at the multi-sectoral approach. We were saying that each individual or each agency has a role to play. That's why you see FACT coming in to assist in identifying those what we call the CCWs, the community child care workers, who would actually go down to all those camps that I've mentioned earlier, and they would cascade the information to the parents as well in terms of issues positive parenting, and also children themselves to understand their roles in terms of what they should do whenever they form of an abuse, and where to report and what procedure might need to be taken to. Because as a department, we take the lead in actually assisting the children in terms of understanding what would have transpired and also make some recommendations, or would actually call the parents to have a sit-in to understand, and also we refer to cases, be it a which might need a medical examination. We would also refer to the Ministry of Health, and would also refer for justice to the secretariat so that further investigation can be carried out to ascertain the degree of abuse that the child might have suffered. Or within a household, there might be some GBV between the mother and the father. We were saying what should be done there within that household is we need also to refer to Women Affairs. Side that we can also understand what could be the troubling, what could be happening within that family, but what might have led to GBV. It might be economic, it might be the shortage of food within a household level. So with FACT, we're working together in these areas that I've mentioned, that is food assistance, and also in terms of the PSS component,